In this lecture, we will discuss about the triangles of neck, its boundaries, contents, and clinical insights. What are neck triangles? The neck is anatomically divided into distinct regions, by muscles and other structures, forming triangles for clinical and surgical orientation. This facilitates identification of underlying nerves, vessels, glands, and muscles. What are two major regions of neck? The neck is anatomically divided into two major regions: anterior triangle and posterior triangle. Each major triangle has further subdivisions. Number 1. Anterior triangle of neck. It is a large triangular region, located on the front of the neck, bordered by prominent anatomical landmarks. Boundaries of anterior triangle are: its anterior boundary is in the midline of the neck. Its posterior boundary is in the anterior border of the sternocleidomastoid muscle. Its superior boundary is in the inferior border of the mandible. Its apex is on the jugular notch of the sternum. The anterior triangle is divided into 4 smaller triangles, by the digastric muscle and superior belly of the mohyoid. These 4 triangles are: Submental triangle, Submandibular triangle, Carotid triangle, Muscular triangle. What is the clinical correlation of anterior triangle? It is a common site for thyroid surgeries, tracheostomy, and lymph node biopsies. It is the site for palpation of carotid artery. In the carotid triangle, now we will discuss the posterior triangle of neck. The posterior triangle lies on the side of the neck, bordered by key muscles and landmarks. Boundaries of posterior triangle are: its anterior boundary is in the posterior border of sternocleidomastoid. Its posterior boundary is in the anterior border of trapezius. Its inferior boundary is in the middle third of the clavicle. Its apex is the site where sternocleidomastoid muscle and trapezius muscle meet. The posterior triangle is further divided into 2 smaller triangles, by the inferior belly of the mohyoid muscle, occipital triangle, and subclavian triangle. What is clinical correlation of posterior triangle? It is important in lymph node excision and brachial plexus injury evaluation. It has risk of accessory nerve damage. During surgery,